200 million women around the world are living with the chronic effects of female genital mutilation. While illegal in Australia, women who have had the procedure before coming here are struggling to find support services. Today is International Day of Zero Tolerance for Female Genital Mutilation. Zubaidah Shaburdin from the Multicultural Centre for Women's Health in Melbourne joins us now. Zubaidah, one piece of positive news is that internationally the prevalence is decreasing, isn't it?
Yes, it is. It's overall, there's been a decline in the prevalence of FGC, and that's been recorded in the UNICEF data last year when it was reported on the same day.
So what is the situation in Australia?
The situation in Australia right now is that FGC is still quite relevant. We do have communities living in Australia who have come from communities that traditionally practice FGM or FGC. And yeah, so we've got prevention programs currently happening across Australia where we are, continuing to support communities to end the practice.
So it's actually being practiced in Australia, and do you think it's being underreported?
Well, I don't think it's been practiced in Australia. There's no research evidence to actually support that fact. There's been a handful of cases, but there is no research evidence to suggest that FGM or FGC is happening in Australia right now. But there are communities living in Australia who have undergone FGC.
Right, so they perhaps take their daughters overseas and then return. Is that how it happens?
Well, not so much. It's more about, because of migration policies and the global movement of people, that people have come from countries where there has been, a high prevalence rate of FGM, and they come to Australia, either as refugees or just as migrants. And yeah, so that's usually what happens. And they're the ones that are currently, having trouble accessing health services.
Because there are reports saying that there are young Australian girls at risk, isn't there?
Yes, that's right. I think you're talking about I think it was early in January, there was a report by the Australian Pediatric Surveillance Unit. And basically it's, the reports does say that there are young girls that have undergone the practice, but that doesn't necessarily mean that that practice was done here in Australia. So what that study actually tells us is that there are girls coming from overseas, through migration programs or through the humanitarian visa, and they're the ones, these communities that come through various forms of migration, some of them have experienced FGM or FGC.
And I mean, there is a lack of awareness here, isn't there? Not only for the general public, but also within the medical community.
The lack of awareness is mostly due to the lack of training, and that also involves cultural sensitivity training on how to speak with clients who have undergone the practice. So there's guidelines already available, through RANZCOG and through RACGP. Guidelines on how health professionals can, speak to their patients or their clients on this practice, but that in terms of how well health professionals are accessing those guidelines and those resources, that's another story.
And so the campaign today, this International Day of Zero Tolerance, it's zero tolerance for the practice occurring, but yet really more tolerance and understanding for those that have already been subjected to this.
Yeah, I think a lot of times, we have to remember that this is a gendered practice, and it reflects a form of gender inequality. So a lot of the times there is a lot of focus on women's genitalia rather than actually, looking into the mental health effects, the discrimination that that communities women from these communities face, the stigmatization. So there needs to be a lot more tolerance and a lot more understanding on why this practice occurs, and and how we can stop it, and the approaches we take. There needs to be sensitivities when we try and approach to end this practice.
And so on this day of zero tolerance, is the message the same for people in Australia as it would be for those on our doorstep, Indonesia, for example, but largely in Africa? They're quite different messages, would they be, considering that the situation here is a little different?
Well, the message remains the same in terms of, we want the practice to end. This is a human rights violation. So, but it's more the approach that needs to be tailored, because in Australia, the communities here, they're migrant communities. They're, women and girls from immigrant and refugee backgrounds. So, the approach needs to take into consideration the migration experience that they face. So there needs to be a whole lot more sensitivities addressed in that respect.
Zubaidah Shaburdin from the Multicultural Centre for Women's Health in Melbourne, thank you so much for joining us.
Thank you.